Hi, this is Jody, and I'm going to interview Jenny, and she's going to go ahead and briefly introduce herself.
Hello everyone, I'm Jenny. I currently work as a home health and hospice nurse in San Joaquin, Stanislaus County.
Okay, thank you for that. So, the first question I have for you, what is the most traditional nursing practice being done in your clinical area?
I think as a home health and hospice nurse, we for sure practice infection control, especially right now with COVID. We have to take extra precautions with properly doffing PPE, as well as hand hygiene and things like that. So the hand sanitizer and making sure we wash with soap for 20 seconds and in warm water.
Okay. So, with that being said, what are some of the sacred cows in your practice area related to quality improvement?
Quality improvement, I feel like, plays hand in hand with infection control too for patients. And I would say the sacred cow we use in current day would be rubbing the hub for IV lines or PICC lines for 15 seconds with alcohol prior to instilling or starting any IVs or infusing any medications, and that is useful in preventing infections.
Okay. So, my second question, along with this, is for the practice that you just identified. Can you tell us why it's still being used today?
I would say it's still being used today because we've seen a positive outcome with it. So there's less incidences where patients will get infections acquired through IVs or PICC lines or central lines, such like that.
All right. Question number 3. What is the culture of safety in your unit?
Culture of safety. Well, I don't really work on a unit, but I work with a bunch of other professionals that work in the office or even out on the field, and we do a lot of teamwork. And I think that plays a huge role in patient safety because things can get missed easily, and so there's always people working together to make sure that all bases are covered.
Okay, that sounds good. For the last question, if you could, what would you change about your practice area related to quality improvement or culture of safety?
I would probably say better communication between all professionals or all disciplines that are taking part in the patient's care. So a lot of times we have to contact doctors to get new orders or at least update them on a change of condition, and at times it's very difficult to get a hold of them and we don't receive a response in a timely manner. So I think that would be one thing that I would change. And then another thing is that even as a home health or hospice nurse, we are short-staffed. So the nurses do get overwhelmed very quickly as soon as the census goes up. So having more people or more coverage in our 6 or 7 counties that we cover would be helpful, and
Okay.
also ensure patient safety at the same time.
All right, did you want to briefly touch on how this could be implemented?
Well, hiring more nurses and maybe creating a more closed communication system between nurses and doctors. So, if we can somehow get a direct phone line or something that can be used in order to get in touch with the doctors, or even an electronic system. But it seems like some people have that in place and some people don't. So, just keeping consistency would be helpful.
All right. Thank you for the interview.
No